and welcome to part 2 of the ABC Please skills. In the last video, we looked at how we can accumulate positive events to improve our emotional well-being. In today's video, we're going to look at the rest of the ABC Please skills. B stands for Build Mastery, C stands for Cope Ahead, and the Please skills look at how we can improve our emotional well-being by looking after our bodies. So what is mastery? Mastery is doing things that make us feel competent, self-confident, in control, and capable of mastering things. When we can build this sense of confidence and competence, it makes us more resistant to depression and those other emotions that we find unpleasant. It usually requires doing something a little bit hard, but also challenging, and the idea here is to develop a sense of accomplishment. Over time, a series of accomplishments leads to a more positive self-concept, higher self-esteem, and a greater level of happiness. Let's look at emotion regulation, handout 19. How do we build mastery? First of all, we need to plan on doing at least one thing a day that helps build a sense of accomplishment. Next, we need to make sure that we're planning for success and not failure, so doing something difficult but possible. When we live a life of failure, we're living a life where our expectations of ourselves are far too high. We then need to gradually increase the difficulty over time. So once you've mastered the first task, try something a little bit more difficult. And look for a challenge. If the task is too easy, then try something a little bit harder next time. Have a think about times where you've experienced a sense of accomplishment and the activities that gave you that sense of mastery. So that's how we build mastery. Now let's take a look at the skill Cope Ahead. Coping ahead is figuring out which situations are likely to cause us trouble, and then not only planning ahead about how we're going to cope with these difficulties, but also imagining being in that situation and coping effectively. Let's go back to emotion regulation handout 19 and look at the steps for how we cope ahead of time with difficult situations. So first of all, we need to start by describing the problem situation. So describe the situation which you're worried about. Once you've described it, check the facts to be sure that the problem you perceive would be an actual problem if it did occur, and then name those emotions and those urges that are likely to interfere with using the skills that you'd want. Next, decide what skills to use. What coping skill do you want to use in this situation? Be specific and write it down in a lot of detail. The next step is imagining the situation in your mind as vividly as possible. So make sure you imagine yourself in the situation, not watching the situation, and be sure to imagine it in the present tense as if it were happening now, not in the past and not in the future. The next step is rehearsing in your mind how you would cope effectively in this situation. You're going to rehearse what you could do to cope effectively, and this includes rehearsing your actions, your thoughts, what you would say, how you might say it. You might rehearse coping with any new problems that come up and coping with the most feared catastrophe about what you feel could go wrong. And then lastly, practice relaxation after you've done this rehearsing. So when should we use Cope Ahead? Cope Ahead is a really useful skill if we know there's a situation coming up that is likely to be difficult for us or lead to an uncomfortable emotion. It's also really useful for new situations that we haven't been in before, or situations where we think we might forget some of our other skills. So let's look at the skill of Cope Ahead with an example. Alice needs to take her baby for immunisations, but she's really anxious about this. She's worried that her baby will cry and that she won't be able to soothe her. So to cope ahead, Alice imagines being in the doctor's surgery, in the clinic room, and with the nurse getting the immunisations. She imagines herself holding her baby to comfort her, but she thinks that maybe she needs to think of some other plans in case baby does get really unsettled. So she imagines herself asking the nurse for help and what she might say and how she might say it. On the day in question, Alice's anxiety went way down because she had thought about how she might cope with all of the challenges that might come up in this situation, and it was able to go ahead without incident. Have a think of times when the cope ahead skill might have been useful for you, or maybe you've got some situations coming up over the next few weeks where you think this skill might be helpful. Let's take a look at the final set of skills in the ABC Please skills. Let's take a look at please. An out of balance body increases our vulnerability to the emotional mind. So the please skills think about the ways that we can look after our mind by looking after our body. Let's take a look at them in more detail. Let's take a look at Emotion Regulation Handout 20. The please skills stand for treat physical illness, balance eating, avoid mood-altering substances, balance sleep, and get exercise. So let's start with looking at physical illness. When we're sick, it lowers our resistance to negative emotions. The healthier we can become, the better able we are to regulate our emotions. One thing that we often hear in the perinatal mental health team is mums struggling with feeling physically unwell, but not taking themselves to the doctors to get checked out. It's really important to look after yourself when both you and baby are ill. So this may be taking some time to yourself if you're able to, maybe when baby's sleeping, making sure that you can get some rest as well. Next, balance eating. So try to eat the amounts and kinds of foods that help you feel good, but not too much and not too little. Both eating too much and excessive dieting can increase our vulnerability to that emotional mind. So when and how often you eat and your daily eating routine can be especially important for some difficulties. Again, one of the things that I've noticed in the groups that we run is sometimes the afternoon groups that we run, mums haven't eaten and it's already past lunchtime by the time they attend the group. So really try and make sure that you're eating enough and eating often. Next, avoid mood-altering substances. So alcohol and drugs, like certain foods, can lower our resistance to negative emotions. So stay off illicit drugs and use alcohol only in moderation. Now the next one is pretty tricky for any mum, and that's balanced sleep. So try to get the amount of sleep that helps you feel good, not too much and not too little. If you can, try and keep a consistent sleep schedule. Now we know that this isn't always possible, especially if baby's going through a phase where they're not sleeping through the night, and it can be difficult. So instead, try and think of ways that you can cope with reduced sleep. So what's going to help you get through the day if you've had a night where you've had very disrupted sleep. Next, and the final step for the please skills, is getting exercise. So aerobic exercise, when done consistently, is an antidepressant. And in addition, having a regular exercise routine can help build that sense of mastery that we were talking about earlier. So try and do some sort of exercise around 5 days a week and try to build up to 20 minutes of exercise each time. And this can include going out for a walk with your baby. It doesn't need to be going to the gym or getting to an exercise class. So I wanted to spend a bit of time at the end thinking about how the skills that we've discussed today can relate to baby. First of all, let's think with building mastery. How can we help our babies build a sense of mastery? Well, there are a few ways that we can do this. We can help them build mastery through their physical development, for example, tummy time, and we can help them develop their language skills and give them that sense of mastery by singing to them, talking to them, and helping them learn and connect words to things. Next, let's think about cope ahead. Now again, cope ahead probably isn't a skill that baby's going to be using for himself right now. And that's okay. This is a skill that you'll help baby learn in the future when they've got a challenging situation coming up. You might help them imagine what's going to happen and how they might cope. So let's instead think about the please skills. And specifically, let's think about sleep. What kind of sleeper is your baby? What cues do they give you that they're tired? So if your baby's a light sleeper, then much like with an adult, if we're struggling to sleep, think about the ways that you can adjust your environment to help your baby sleep. Is the temperature of the room okay? Is it dark enough? Think of those little adjustments that you can make that might help your baby with their sleep. So that's it for the ABC Please skills. In the next session, we're going to be looking at crisis survival skills. These are skills that we can use when our emotions feel too overwhelming and we need to bring ourselves down quickly.